There's a new concern with the use of semaglutides such as Wegovy and Ozempic, not only for the treatment of type 2 diabetes, but for weight loss. And that concern is the development of a deep vein thrombosis, or a DVT, better known as a blood clot in the leg. It was found quite by accident. You see, in 2021, a study was undertaken. That study was called the Comprehensive Analysis of the Safety of Semaglutides for the Treatment of Type 2 Diabetes. And they were specifically looking for serious adverse events. And boy, did they ever find one. They found a 266% increase in the risk of developing a DVT in persons taking semaglutides. And it didn't matter if it was for control of diabetes or was it for weight loss. In this video, I'm going to discuss why they think this is occurring, and it's quite serious. I do have a short form video of this, but I wanted to make a longer one because I think it's pretty important, because we've already had at least 3 fatalities from pulmonary embolisms in persons taking Wegovy or Ozempic. We're going to also look into how can you tell if you're developing a deep vein thrombosis, and how can you tell if it's become a pulmonary embolism. So watch to the end. And also, I would appreciate it if you would click subscribe, hit the bell, give me a thumbs up. This way I can continue making these educational videos. They were concerned as to why this was happening. Was it because of the semaglutides? Or was it due to a physiological change that the semaglutides made in your body? Turns out it's probably going to be a bit of both. Remember, even though this is 2021, it's still relatively new and they're still investigating this. It's not even in the package insert yet. Well, they found that people who were taking the semaglutides and had digestive system issues, specifically chronic diarrhea, developed a chronic dehydrated state. And that dehydrated state increased the viscosity or the thickness of the blood, basically increasing the potential for the blood to coagulate. They also found that some of the glycogen-like proteins in the semaglutide increased fibrinogen and thrombin levels. Both of those elements are critical in clot formation. So it increased the risk of clots being formed. They also found that some of the veins were inflamed and the internal walls, or the lumens, were also inflamed. When you have inflammation like that, the potential for platelets to cling to it and then form a blood clot is increased. So these 3 factors are weighing in very strongly. So we have a mixture of what the Ozempic is doing and how some of the substances in the Ozempic are creating problems that make your clotting more likely. Now, people that make blood clots tend to be the same people that need this medication. Obese people, diabetics, people with congestive heart failure, people that are extremely overweight leading to motion problems. All of these things increase your risk of developing a deep vein thrombosis. So how could you tell if you're getting a deep vein thrombosis? You usually get some swelling of the leg. It also can become very warm and tender, particularly around the calf. When you walk, when you toe off, it starts to hurt. If you lay back and someone pushes your foot upwards, that also hurts. That's called a positive Holman sign. Now, if you start to develop any of these symptoms and you're on Ozempic, or even if you just hurt your leg in the backyard, it's imperative to go to the emergency room right away. They could do a Doppler study and see if you're developing any type of blood clot in the deep vein system. Now, should you be developing a blood clot, they'll most likely put you on anticoagulants immediately to prevent further development. If they find that you might have an unstable clot and the risk of you getting a pulmonary embolism high, they might actually do a surgical intervention and place a filter in that could help trap the clot should it break off. When a clot starts to fragment up, it usually travels up through the heart and most of the time ends up in the pulmonary artery of the lung. Now, if there are small fragments, you might just get short of breath and you might get a little sharp chest pain. When they're larger, you'll start coughing. You might even cough up some blood should it cut off the blood flow to a piece of lung and that piece of lung starts to hemorrhage. If it turns out to be a larger piece of the clot, then you could start to get gas exchange problems where you'll plug off all the blood flow to the lung, creating pressure into the heart, often leading to instant heart failure, and a lack of gas exchange at the lung. There's no oxygen getting it in, there's no CO2 coming out. You become hypoxic quite quickly. You will start to become tachypnic, in other words, breathing greater than 20 times a minute. You'll turn cyanotic, blue, purple lips, and it's not compatible with life. Now, if they think you've been developing small pulmonary embolisms, they could do a blood test called the D-dimer test, and that will show potential fragmentation of the clot. Again, if you start developing pulmonary emboli, sometimes they could dissolve those clots, sometimes they just break down on their own. But it's very important to try to avoid getting the pulmonary embolism in the first place. So if you start to show symptoms of getting a DVT, go to the emergency room because you don't want it to start breaking off and becoming the potentially fatal pulmonary embolism. I hope this gave you some information on what's going on with this new finding, developing of blood clots in persons taking semaglutides, and that included Ozempic, Wegovy, and Mounjaro. Mounjaro probably slightly less, but remember, that is still a semaglutide, just a different name. Hope you learned something. Take care. Have a good day.